to the organizers of this 7th Asia International Conference, to the panel of evaluators, my fellow participants from the different parts of the world, a pleasant day to all. I would like to share our study with the title Phenomenologizing the Mental Health Status of Students in the Midst of Pandemic. The COVID-19 outbreak and the subsequent lockdowns have taken the whole world by a storm. The negative consequences of the unique coronavirus infectious disease or COVID-19 on the society includes illness, death, grief, unemployment, social isolation, disruption of education, and absence of access to resources and services due to infection control limitations. Moreover, the pandemic brought not only the risk of death from the viral infection, but also unbearable psychological pressure to people in the country and the rest of the world. The epidemic's continued expansion, tight isolation measures, and delays in the opening of schools, colleges, and universities across the country are expected to have an impact on college students' mental health. With the objective of assisting authorities in formulating more effective responses to mental health issues among students in these trying times, this study serves as a developing theoretical basis for evaluating psychological well-being and establishing evidence-based mental health intervention strategies to assist students during the pandemic. Finally, it may provide policymakers with guidelines on potential mechanisms for mitigating the effects of mental stress on students during health emergencies. For the methodology, a total of 20 participants were involved in this qualitative research. The data were collected through semi-structured interviews. Furthermore, this study utilized qualitative design employing interpretative phenomenological analysis as an approach to capture the lived experiences of college students affecting their mental health status during pandemic. For the results, the thickness and richness of the field texts gathered afforded the identification of the emerging 5 interesting themes relative to the stressors of students during pandemic. These include financial struggle, academic-related stress, health issues, social isolation, and relationship issues. Furthermore, students were able to apply coping strategies to alleviate their mental stress during the pandemic. The coping mechanisms they employed include seeking support, maintaining positive behavior, utilizing social media for communication, and self-management. Thus, the result contextualizes the various mental health issues that students experienced in the midst of the global crisis. To mitigate their mental stress, students were able to apply coping mechanisms such as seeking support from family, friends, teachers, and relatives, maintaining positive behavior, utilizing social media for communication, and the application of self-management. And then the study findings suggest a strong need for university administration to realize the necessity for an effective and comprehensive policy to identify and mitigate the psychological effect of COVID-19 or any future outbreaks that affect students. In addition, the university administration, in collaboration with the guidance counselor, technology experts, and all year-level advisors, should prioritize the development of online psychological interventions, such as online applications, in addition to other services, such as text messages, chat lines, phone calls, and forums. Finally, the institution should implement structured programs to address mental health difficulties, including mindful therapy, like skills training, which have been shown by experts to reduce stress levels. That would be all. Thank you.